Howdy everybody, my name is Renee Johansen and I would like to introduce you to a new possible way for treating COVID-19 in the future. A literary review was performed in order to gather information on the workings, advantages, and methodology for using Cas13, an enzyme, as a therapeutic agent to treat COVID-19. We are in dire need for new ways to treat the disease caused by the virus SARS-CoV-2. It is a possibility that in the future we could use genetic editing as a tool to stop viral replication inside cells. CRISPR is a genetic editing tool that was discovered in the last few years in bacteria. Bacteria use CRISPR to stop viral infections, and we may be able to use this to our advantage. More specifically, there is an enzyme called Cas13, which uses a guide RNA to target RNA. The guide RNA allows Cas13 proteins to bind to the piece of RNA that matches the guide sequence. Once it's bound, Cas13 degrades or snips the RNA bound, rendering it useless for replication. This image here is a representation of the CRISPR-Cas13 complex. The guide RNA is permanently bound to the case proteins, and it is a most wanted sign for the bounty hunter Cas13. When there is a match between the guide RNA and the RNA found inside the cell, the enzyme will perform a series of chemical reactions in order to break the bonds of the RNA. The CRISPR-Cas13 complex could be introduced to the human body, specifically the respiratory and other affected organs, by aerosol, the same way an inhaler works, or by IV infusion, such as being diluted into a saline solution. After introduction to the body, Cas13 can disrupt replication of the virus in infected cells by snipping the RNA genome at various stages. Some stages where the Cas13 can be found to be the most active is after viral entry and genome encoding, during RNA replication, and during viral packaging. If the RNA is snipped right after entry, just before replication, it is possible to stop the replication at the beginning. If the RNA is snipped during viral packaging, the virus will not be able to replicate in the next host cell, since it does not have a complete copy of its genome. Cas13 is currently being used as precision diagnostic and in mammalian cells to turn off the expression of RNA strands. Cas13 has the potential to become a therapeutic agent since it can influence expression of RNA but does not alter the genome of the host. According to our results, CRISPR-Cas13 complex can be safely introduced into the human body in order to disrupt the replication of SARS-CoV-2 at multiple stages. There is limited risk on using this kind of genetic editing due to the fact that Cas13 enzymes do not have the correct RNA for human cells. And without this guide RNA, the Cas enzymes do not have the correct RNA for human cells, and without this guide RNA, the Cas enzymes do not bind and is rendered useless. The next stages for this technique would be to start in vitro testing to determine its efficacy and effectiveness in infected cells.